today, my today's topic, amoebiasis. Amoebiasis is a disease caused by the protozoa amoeba, and they are characterized by the damage to the large intestine and bloody diarrhea. Etiology. The disease is caused by histopathogenic amoeba, Amoeba histolytica. Two forms of the amoeba are identified. One of them called the vegetative or trophozoid, and other called the cystis. Cystis are found in the fetus of individuals who carry the cyst in the external environment. Epidemiology, the disease source, the main source of the disease is a person carrying cyst, and there are two forms of the amoebiasis, and epidemiological characteristics include through water and through food contaminated with cyst, and household contact also play a role in the transmission of amoebiasis. Clinical forms of the amoebiasis. There are two forms of amoebiasis, intestinal and extra-intestinal amoebiasis. Intestinal amoebiasis had two forms, and acute up to 3 months and chronic more than 3 months. The disease and according of the severity and include the mild, moderate, and severe form. The intestinal form of the disease clinic, if the incubation period lasts 2 weeks, about 2 months, and the disease begins with prodromal symptoms such as malaise, loss of appetite, and heavy feeling of heaviness in the epigastric region, and flatulence occurs. And the stool and the defecation becomes more frequently, and this stool resembles respiratory juice, and because the intestinal contents consist of a mass of mucose mixed with blood, and extra-intestinal amoebiasis clinic, and the most common is hepatic amoebiasis. It is can in two forms, and hepatic amoebiasis and liver abscesses. Hepatic amoebiasis causes the liver to enlarge it, and there is pain in the right rib, and sometimes jaundice develops. And the permanent symptoms of the liver abscesses is an enlarged liver and intense pain in that area. And complication complication of the disease include skin amoebiasis. Skin amoebiasis, penetration of the amoebia into the skin and causes the erosions and ulcer of forms of the forms on the skin, and the complications of the intestinal amoebiasis include the peritonitis occurs as a result of perforation of intestinal wall and rupture of liver abscesses, and the scarring of ulcer in the intestine and can lead to narrowing of the intestinal lumen or intestinal perforation. And the diagnosis of the disease is based on the epidemiological and epidemiological history and laboratory and clinical symptoms, and to accurately determine examination. The feces should be examined under microscope, and immediately after defecation. Under microscope is found erythrocytes, lymphocytes, and the intestinal epithelial cells, and Charcot-Leyden fiber, and the rectalonoscopy examination is used in the morphological examination. And treatment of the disease, the most effective drug is emetic hydrochloride, and the liver abscesses quinidine, and can also use Yatrin, metronidazole, and tricapol, and etc. Prevention measures at the source of infection include treatment and detection of amoebic cyst excretor and cyst carrying. I am finished. Thank you for your attention.